Hello, my name is Sokhib, and I am the first co-author of this article named Feasibility of Deep Learning-Based Diagnostic Platform to Evaluate Low Urinary Tract Disorder in Men using uroflowmetry. Now I'm serving as clinical assistant professor in Department of Urology at Seoul St. Mary Hospital. It is great honor I have chance to explain my work in front of favorite reader of ICUrology. This article is about AI-based new technology to predict male low urinary symptoms. This article is collaborating work with Future AI Center in Samsung Medical Center and Department of Urology of Samsung Medical Center. Now I will introduce my work with some PPT pages. Pressure flow study is golden tool to evaluate patients with voiding dysfunction, but it has big disadvantage that is invasive. Therefore, we created a diagnostic prediction model for bladder outlet obstruction and detrusor underactivity using only uroflowmetry graph. We applied a convolutional neural network in this system. Convolutional neural network is recently focused on optimizing technology for analyzing patterning and predicting trends. We reviewed 4,835 men who underwent a pressure flow study at Samsung Medical Center between December 2016 and December 2017. Those with diseases that can affect lower urinary tract function, as like bladder cancer and prostate cancer, were excluded. Patients who underwent previous prostate, bladder, and or urethral surgeries were also excluded. Patients with history of cardiovascular accident, neurologic disorders, and spinal or pelvic bone trauma that could affect LUTS were also excluded. Total 1,792 male patients were included. Among them, 482 patients had BOO and 893 patients had DUA. There were no significant differences among patients. To evaluate our model, five-fold cross-validation was performed. Pre-processed images were randomly divided into 5 non-overlapping subsets. 4 subsets were used for training and 1 was left for validation. Validation set was compared with pressure flow study result and recorded its accuracy. This process was repeated for all 5 subsets so that each subset was evaluated as a test set once. As a result, the AUROC scores of DUA was 73.30% and BOO was 72.23%. This accuracy would be increased if we applied more patients to training sets. Our study suggests that it is possible to differentiate DUA and BOO with analyzed uroflowmetry graph using AI model. Thank you for your listening.